Good evening, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James. I'm the owner of Limbs and Things, mobile and telehealth physical therapy practice. Tonight's Pull Up with Limbs and Things is about tips for aging adults from a neurologist. And tonight we have Dr. Latia Fox, and she is coming to us from Jacksonville, Florida. But she is a Washingtonian. She went to Banneker High School and she graduated from Juniata College with her undergraduate degree and then went on to Ohio University College of Osteopathic Medicine to earn her DO degree. She is also a board certified neurologist, and I am happy to have her tonight. Welcome, Dr. Fox. How are you?
Well, hello. Thank you so much. I'm honored
Yeah,
to be here. Good evening, everyone.
yeah, good evening. So, we wanted to talk a little bit about neurologic cases and what we can do to hopefully prevent a situation as well as to remedy a situation should it occur. So, please tell us a little bit about what a neurologist is.
Oh, sure. So that is an excellent question. So a neurologist is a physician that specializes in the brain health and the health of the brain and nervous system. So like the brain, the spinal cord, all your nervous system. And we look into different disorders, and most commonly, some types of things that we deal with would be patients with strokes, whether that's something happening acutely or some people dealing with chronic issues from strokes, seizures, migraines, multiple sclerosis, anything that would affect your nervous system we deal with.
Right. So, if you're watching and you are live, please hashtag live so we can know that you're here. Otherwise, we can't see you. And then you can hashtag replay if you're catching this after we've aired live. But it's a good opportunity for us to talk about some of those things that you just mentioned. So, strokes are really common, but we're finding that there are so many happening in a younger population. What would you say the current age or average age of someone who's had a stroke that you've most recently encountered?
Yeah, that's a great question. Typically when we're thinking about strokes, we're thinking this is someone in an older age, 60s and 70s. But I've actually been seeing a lot of young people, even in their 40s, having strokes. And to me, it's kind of scary. So I've kind of been thinking, like, okay, what is going on? Is this a product of our diet, our exercise? What is it? I think also sometimes people have different things that may run in their families and maybe not open to talk about it. So some things could be opportunities that are missed. But I feel like a lot of it has to do with what we're really taking in. And also, I think when we're still in like the 30s and 40s, a lot of us still feel invincible. And, we really haven't seen a doctor or having any medical care. So I feel like that may play a big role in it as well.
Absolutely. What about the person who may have not been to the doctor on a regular basis and then they're finding that I'm starting to have some symptoms that just don't seem like my normal self? Are there any symptoms we should look out for that say, okay, this is a red flag, let's do something about it?
Yeah, I think, a lot of times we just kind of are used to going about our day-to-day activities and we're not kind of focused on our bodies because we feel healthy, we feel strong. But I would definitely say if we're now starting to have headaches or we're getting dizzy spells or we're just kind of feeling off and we just don't know why, sometimes that can be a sign that we may be having things like high blood pressure. High blood pressure is something called a silent killer because a lot of times people don't know that there's something bad happening until they're in the hospital with a stroke or a heart attack. And so some of those things can be prevented by, screening. So not necessarily always having to jump into the doctor, but even some people, they have blood pressure machines at grocery stores and different places where we can periodically check and see, hey, where is my blood pressure? One of the things is a lot of young people come in and they get slammed with all of these different diagnoses. Like they may have had a heart attack, they may have had a stroke, and then they're like, well, my blood pressure is high, my cholesterol's high, I got diabetes, and
Yeah.
those things can be brewing in the background without knowing. So I think getting checked at least yearly after a certain point would be a reasonable thing to do.
What's the certain point?
That's a good question, and it's kind of hard to say. But I think as we're starting to get into our 30s, at least getting periodically checked would be reasonable. And then, of course, depending on different health guidelines for females versus males, there may be some other screenings taking place. But I think if we at least, have someone like a primary physician that we're getting checked with, I think that would be great.
Absolutely. Yep. I would think everybody's getting an annual checkup. You don't find that, huh?
No, no. And some people, they seem like they get away with it for a while, but then they come in with all of these devastating type of diagnosis. So I think the best thing to do is if we were getting checked periodically, sooner than later, then that kind of gives a tone where we know, okay, yeah, we've been healthy. This is something new we're dealing with.
Hmm.
Or, sometimes people can have things brewing in the background and just not know because we're not getting checked. I mean, it's like one of those things you feel good until you're not.
That is so true. That is so true. Yep. I agree. So, from a rehab standpoint, we are seeing people who are younger that complain of certain things, but they're there for something else. So, a person is coming in and they're saying, okay, I sprained my ankle or I'm having this knee surgery and I'm getting rehab for that. And then they say, well, I've just been having this headache. It won't go away. I'm having some changes in my vision. I'm having some other issues. And it seems like your therapist or your physical therapist is then telling you, you probably need to go to see someone because then we're checking your blood pressure and seeing that it's really high and it's a great
Yeah,
chance that something detrimental could happen if we don't do something about it.
definitely.
So, yeah, I just think it's really important, especially as the younger aging adults, that we look at those things because the stresses of life can cause those things and everything else. But you got to do something about it before it becomes a problem.
Yes, I definitely agree. I find that sometimes, especially as we're younger, we kind of just get used to ignoring things. So, like sometimes it feels like you have a lot on your plate. Some people may be working, may be in school, may have families, children. And most people are just thinking about bringing in the money day to day, how they're going to survive. So then
Right.
when you add thinking about, okay, I need to get my body checked out, that's kind of like, whoa, I'm fine. I feel great. But
Hmm.
I feel like that can be a detriment as I kind of get more wisdom as I'm getting older too, and seeing people dealing with these different issues. I started to see that, self care is one of the best things that we can do. And sometimes that does involve, getting our annual physicals, but also taking time for ourselves. Like I think you mentioned something that's really critical. Stress can really play a huge role in a lot of these things. And I feel
Absolutely.
like, it builds and it builds and it builds. And then after a while, we're tripping up on things that we kind of swept under the rug until like it's got to a critical place. So I feel like, finding that time to do things that are going to help us mentally, physically, emotionally, all of that plays a role in our overall health and how we're going to do, how we're going to succeed in life. I think we all can identify some people that we've encountered that are what we call a young 40 versus an old 40, and while sometimes genetics may play a role in that, I feel like a lot of it is lifestyle. I mean, we don't really know what's behind someone's doors, what they've been dealing with throughout their life that kind of get them to that place.
Absolutely. So let's do a little deeper dive. So let's
Okay.
look at strokes. There are a lot of us who, for lack of a better term, get a taste of what a stroke is like with a TIA.
Okay.
What should you say to the person who's had a TIA to prevent them from having a serious or more severe stroke?
Sure. So let's talk about what is a TIA. So
Yeah.
it's a term that means transient ischemic attack. And so, for clinical terms or just for simplicity, someone may have experienced some stroke like symptoms. So, maybe that's numbness or tingling on one side of their body, weakness, or some people may have had facial drooping or where they couldn't speak or walk. And usually that's for a short time. Most TIAs last about 15 to 30 minutes, but by definition, that can last up to 24 hours, and then those symptoms start to resolve. And so, to us as neurologists, especially as this is something we see very frequently in the hospital, we're kind of on red alert with that because we know that if we don't make any interventions or do anything to kind of evaluate why is this happening, Some people will have a high risk to go on and have an actual stroke, which could leave them with permanent damage. So, some of the things we usually look into are trying to see, okay, what is the risk? So, we've been talking about, do we have high blood pressure? Do we have diabetes? Do we have cholesterol?
Hmm.
Those are three big ones that we know are highly associated with risk of stroke. So, if those are something that we're dealing with, we're trying to work on regulating them. Smoking is a huge thing that people don't really think about, but I
Right.
feel like it's like adding gasoline to the fire. So it kind of accelerates damage to your blood vessels, that can lead to you having a stroke. So if we're smoking, we want to quit smoking. Some people are engaging in other behaviors that can be risky, like illicit drug use, other type of things, can increase your risk of having a stroke. Looking into your family history. I kind of mentioned that before. Some people may have had people in their family with strokes at an early age or blood clots or other things that we look into and we just, don't think about. And then once we discover, okay, yeah, I had a TIA, okay, maybe we're working on controlling our risk factors. Sometimes, depending on each individual case, your physician may want you to be on an aspirin regimen. That's not something we would recommend without discussing with a physician or without having a diagnosis leading to that. But for some people that are dealing with TIAs or strokes, that may be something very commonly we're doing. So we're trying to look into what can we do to prevent this, because we know the TIA is kind of like warning,
Right.
warning,
Right.
you're at risk. And so we want to prevent you from having a big stroke.
Absolutely. So if you're listening, you have a question or a comment, please put them in the chat and we'll answer them. We want to make sure that your question is answered and that we give you the best information we can. So let's then talk about those who have had a stroke. And like I've encountered a couple of aging adults who've had a stroke that affected their right side. Shortly thereafter, they've had a stroke that affected their left side. Do you
Oh my
know
goodness.
how much of a rehab situation that is? So
Yes.
yeah. So tell me about people who have strokes and then have a recurring stroke and how that affects that person and what they can do possibly to prevent it happening to them if you've already had one.
Yeah, so I feel like that is a very challenging question to answer. So it's definitely not something I can give a like a general response other than to say I definitely would advise those patients to work closely with their neurologist. We look at each case differently. So I know that, in a day I may have 10 patients with strokes, but each one of them have different things about them that are leading to this. Some people may have something going on with their heart. We know atrial fibrillation is a huge risk factor for having stroke.
Absolutely.
One of the things that we don't like to talk about as a society is our own role in our health. So,
Oh yeah.
sometimes we are going to the doctor, we're doing different things, and the doctor is telling us, okay, you need to do this. And for whatever reason, we do
Don't do
that for a little short time and we're feeling good. And now we feel like, okay, I can stop taking my medicines, and so I do see a lot of people coming back in with another stroke because they stopped following the recommendations. Like I've seen people watching commercials. I've had this frequently happen. Oh, my commercial told me that aspirin was bad for me. And even though my doctor put me on this medicine, oh, the commercial told me it was not good. So instead of talking to their physician about why am I on this? What are the risks to me? Some people take their self off of medicines. And so then we're coming back in with more events, or sometimes we're telling people, okay, you really got to quit smoking. And unfortunately, that's a really challenging thing to overcome, but sometimes it's
absolutely.
very necessary. So part of it is we have to take our role in things too. I think of a saying that says you can bring the horse to the well, but you can't make
Can't
them
make them
drink.
drink.
So
That's right.
we do have to take our responsibility, but also sometimes people are listening, they are doing the right things, and they still have another stroke. So I feel like in those cases, definitely talking with their doctor about what may be causing this further. Are there some other things that we can do to help prevent it? And so each of those things will be on a case by case, looking at what is that particular risk for that person.
Gotcha. Okay, shifting gears.
Okay.
Parkinson's disease. I'm seeing a lot of people with that, but excuse me, so many people find that Parkinson's takes a while to diagnose. And so they are experiencing symptoms, but are not sure what it is until they have possibly a situation that has led them to a hospitalization. So they've fallen, or they've had some issue, or they've hit their head, or they've injured their arm, or something like that. So tell me a little bit about your experience with Parkinson's and what anyone can do to um, get further along in the diagnosis process before a catastrophic event happens.
That's a very good question. And again, some of these things are very tricky. So, Parkinson's disease is what we call a neurodegenerative process. So, that basically means that certain parts in the brain cells are breaking down. And so, in the case of Parkinson's, there's a chemical in the brain called dopamine that helps us to make movements and to regulate how our movements are. And for some reason, that starts to deteriorate. So, it is something that is what we call a progressive disease, but we have actually a lot of treatments that can help people with the symptoms. So some people that have Parkinson's, they may start to develop tremors. That can be one of the most common signs that people have. And unfortunately, a lot of people with Parkinson's are not even aware they have that tremor because it can happen to them when they're resting. So they can just be relaxing and a little tremor comes and they may not notice it until like somebody tells them, hey, why are you having that tremor? What's going on? So it's very challenging to prevent bad things when some of those diseases, you don't have a real good insight about them. Some of it does take external people noticing. Some other things that we may experience other than tremors, they may experience difficulty with walking, like we described that people are shuffling or kind of dragging their feet. But some of those things don't come out till later. So I feel like that's something that can be a little challenging. But if you're starting to notice that you're slowing down, you're not moving as quickly as your peers, or if someone has been talking to you about tremors and you're not aware of that, that may be a great reason to get evaluated by a neurologist. So those are definitely things that are bread and butter and we know very well and can help diagnose.
What would the process be? You go to your primary and then they give you a referral to a neurologist, or can they go direct?
Generally, so every state is different. I know in Florida, most neurologists do require referrals from the primary physician. So I would say, in general, if you notice or someone that loves you notice that something about you is changing, like you're
Mm-hmm.
not yourself, some new issues are emerging, whether we're talking about Parkinson's or anything else, or like, you were someone that never had headaches and now all of a sudden you're having headaches. These are reasons to go to your primary doctor. Something that's changing from your normal is usually a good reason to get checked out.
Absolutely. So we have a question over here. I think it goes back to our discussion previously. AFib, what exactly is it?
Okay, great question. So AFib is short for atrial fibrillation, and it's an irregular type of heartbeat. And so basically, what happens is your heart starts to kind of beat erratically or irregularly, and that can have some risk of forming like little clots or increasing your risk for emboli, which are little clots that can travel and go up to the brain and cause stroke. So that's the main thing that we see as a risk factor for atrial fibrillation. And so when we're talking about looking into risk factors for strokes, that's one of the main things we look for.
Okay. Follow up question: how can AFib be treated without meds?
That's a great question. Not a cardiologist, but I do know that meeting with one could be helpful because they have different options that they may be able to offer. So I can't answer that in depth, but I do know that a cardiologist would have many different options they can talk to you about for treating it.
Sounds good. Okay. Is there any diagnosis that you're seeing more of, specifically in adults as we're getting older? Not necessarily in children, but one that you see and you want us to know more about so we don't get it.
Okay, that is a good question, and I'm not sure how we don't get it, but I do see a lot more people dealing with dementias, things like Alzheimer's disease, vascular dementia. So with vascular dementia, we're talking about more of having some type of recurrent strokes or blocking of or narrowing of the blood vessels. So we know we can do things to help decrease our risk of strokes. But I do see more people developing cognitive issues, and I think that's something that's going to be a hot topic in neurology. There's a lot of research taking place about how we can slow the progression. There's new medications that they're looking into. I believe one just got a FDA approval. And so
Mhm.
those are things that are coming down the pipe to see what can be done about that. But that's something that's definitely of concern that I hope that as time goes on, we'll start to develop more ways to intervene upon, or if it ever comes to preventing it, that would be fantastic. But it
It
is
would.
something
It really would.
that is quite devastating and been seeing a lot.
Absolutely. Are you seeing it more with a particular age group or just across
Um,
the board?
Still with elderly people, so I'm thinking like 70s are usually around the group. I
Hmm.
have seen a couple of younger people, like in their 40s or 50s, but that's pretty rare, and some of that can be linked to different genetic disorders. That's not very common at all.
Good. Here's another question for you. Is weight loss a cure all for all preventative problems like high blood pressure, stroke, heart disease, and diabetes?
I would not say it's a cure-all, but it definitely can help to regulate those things. But I think we all know someone that is not overweight or obese that does have these problems. So that's why I say it's not a cure-all. But for most people, it can definitely help. I certainly know of plenty of people that once their weight has gotten controlled, that was a great way to put those things back into regulation, but I don't think that that's all of the problem. So, yes and no.
I agree. Just like with people think they take weight off, it reduces the pain in their knees and joints and stuff. It does, but you also got to move.
Yeah.
If you don't, then stiffness sets in. But it's like a combination. Everything has an equal and opposite reaction. So you've got to work to making sure that you're covering all your bases as best as you can, because we can't prevent everything just by doing one thing.
Correct. And I think, unfortunately, disease is one of those things that's very complicated. So you can have skinny people that have high blood pressure,
Hmm.
heart disease, cholesterol, all kind of stuff. And some of that has to do with genetics and what
Right.
kind of diabetes they may have, like type 1 versus type 2 diabetes. But for in general, for the majority of people dealing with those issues, weight loss, one of the things we haven't talked about is a healthy diet and exercise. I feel like that plays a huge role in our overall health and in helping us to regulate and decrease our risk factors that we would have for strokes and other things like that.
Absolutely. Okay. What about multiple sclerosis? There are so many people, young people, and young black females that are being diagnosed with multiple sclerosis. I've just seen a trend in it just from people that I know, but also in working with a few, and I just wanted to know, have you seen anything that has shown the trend in that population with multiple sclerosis? And you could talk about what it is too if you like.
Sure. So, multiple sclerosis is something that we do consider to be a disease of young people. So, very commonly, this is seen in females somewhere between their 20s and 40s is the most common group affected. Certainly, there's outliers in any disease, and I think that affects females in general. So not just African American females, but all females have kind of a higher predilection of getting multiple sclerosis, and it's a type of autoimmune disease where your immune system can start to attack the cells of your nervous system, particularly what we call myelin. So in the brain, you have axons, and all of this goes back to chemistry. We probably don't want to think about, but some of those science classes did have some merit back in the
Yes.
day.
Uh-huh.
But those cells help our brain to communicate with each other and help us to move and function. And sometimes the immune system can attack itself. And so people with multiple sclerosis can have episodes of like vision loss, weakness, trouble walking, maybe trouble speaking. And usually those type of episodes can last for several days to several weeks, and then they kind of remit. So the most common type of MS involves a attack, like an inflammatory episode, and then they usually slowly get better. So with those patients, I wouldn't necessarily say I see it trending upward. I just feel like we're better at recognizing it, and we have more diagnostic tools that can help us to diagnose it a little bit better than before.
That explains it. Okay. Is there anything that you want to share that you have not shared already?
I think in general, because we're talking about tips for the aging adult, so
Mhm.
something that I need to take home for my own self is I feel like one thing that would help all of us, in no matter what disease process we're dealing with, staying active, staying engaged with our community, eating healthy, really watching what we're taking in, engaging in exercise, staying socially active, staying mentally, spiritually, emotionally sound. All of those things will help us in general for our overall health.
Absolutely. Well, I'm so glad you joined us. It's always great to have a fellow Banneker graduate, and it's good to have you here. I'm glad we reconnected at the National Academies of Science. And
Yes.
everyone, if you have any questions or comments that you want answered that we possibly did not ask, you can leave them in the chat. Thank you so much, Dr. Fox. I hope you have a great evening.
Thank you. And thank you for having me. And thank you, everyone, for joining. Have a great evening.
Yes, happy Black History Month, everyone. We'll be back next month. Take care.